home. So things are changing, and we also see a shift from institutional care to self-care and home care. So we're going to talk about that a little bit later. One of the biggest drivers for change is that we have an aging population, right? You know that. You can see here that almost 90% of the Americans will be over 65 by 2050. And also the problem, because we can keep people alive much longer now with the advanced in medicine when it comes to drugs, etc., and treatments, but the biological clock is pretty much the same thing. So it means that the chronic diseases, they kick in with a higher age. So it's typical that an 85 plus person have like 3, 4, 5 chronic diseases. So this is a new situation. So, and another way to look at it is to see this interesting ramp here. Change from 2012, I'm basically from now and going forward. So this is the total population change in the US. And then you see these curves very rapidly going upwards. And just to confirm my thesis there, is that the prevalence of chronic diseases are unfortunately going the same way. So how do we tackle this then? That's an interesting question. And you can say that, okay, in Sweden then, how does it look like there? Pretty much the same. Sweden is actually not very bad, I mean, in a very bad situation. There are other countries much worse off, like Japan. There will soon be 1:1 ratio between pensionists and people making money in Japan. China is also, a lot of things are happening because of this one-child rule that they have, so that now it's exploding in the wrong direction. So this is a global thing. Just drill down a little bit in Sweden, so you can see here you have the share of the population that are 65 plus. So blue is few and red is many. So you can see this is just from 69 and then goes to 78, 87, 96, 2014. So it's not just in the politics that Sweden has gotten redder, right? But the interesting thing here is Stockholm. You can see Stockholm doesn't have this problem with as much with an aging population, but there will be another problem with available resources for healthcare. So Stockholm will afford to handle this, but they also, Stockholm needs to invest a lot in new technology to handle it, because there will not be enough people out there. So, but you can see many of the Swedish communes or municipalities are pretty red and very, very, very far away. So that's also a case for telemedicine, for instance, and home care. So this is a very interesting picture. We can talk a lot about this. So how do you handle this situation? And the thing is, I'm really for looking at other industries. What did other industries do a couple of years ago or recently that could be applied in healthcare and social care? And you've all seen this picture. It's old now, but it's still good. You've seen this is the Pope inauguration in 2005. And back then, people knew how to behave. So they were just silently watching the ceremonies here and not destroying the atmosphere by, Facebooking and Twittering. But this is the solution. There's an UK health economist, Paul Corrigan, and he says that this is the solution for the health. One part of the solution, besides technology, for healthcare is to find new value creators that currently are not considered being value creators. So what these guys are doing, in effect, they're working for the Pope's PR department and the Facebook's revenue generating department. So we outsource a little bit of the work to them. If we translate this into healthcare, this could mean, for instance, a person filling out a form or filling out a form directly using a computer or something like that will not, maybe today it's captured twice by the healthcare staff First they write it down on a piece of paper, and then they digitize it and send it to a quality register. So where do you find these new value creators? One answer is, you have probably seen these pictures from the patient/researcher Sara Riggare. You probably know her. She's has had Parkinson's since 12 years old, since she was 12 years old or something. But she also is a researcher at Karolinska Institute. And she drew this picture, and this is actually 8,766 dots. And Magnus, what does that typically represent? 8,766. You're a scientific year when it comes to hours. And you can see a lot of blue circles here, but this dot here, that represents the 1 hour she meets with her doctor 2 times a year. You can imagine that what you see in healthcare is just the tip of the iceberg. You know, a lot of things are going out here. So what if she could get very, very good tools to understand what keeps her healthy out here? If she had tools so she could share that knowledge or that information with the medical staff, so they could see what makes a Parkinson patient function better, you know. And what if in these blue dots she could connect to other people like you do on Facebook to get knowledge on how to cope with her chronic disease? And if you have these people, there are a lot of research done on this. What's your primary source for medical information as a chronic patient? And they say 90% it's internet, 10% from the profession. But at the same time, she says, I can't live without this. But just to understand the power in this, she has developed an app where she tracks her ability to operate both physically and cognitive operation level, and by tracking that and then matching it with her drug scheme, which involves 6 different pills taken at the 6 different occasions in 6 combinations. So she has a device that helps her to take that medicine, but at the same time she does a very famous tapping test, which now also Apple has in their ResearchKit application. So she taps like this, and she can monitor how well she functions. By doing that, she reduces the cost for society from. Without that, they would be spending 350,000 kroner per year on medication. Now she managed to handle it at 50,000 kroner, and the quality of life for her is much better. Okay, we take these. I mean, Facebook and Twitter. They used to be for the young people, but now it's for parents and grandparents. My kids tell me. But we also have a lot of new eager. I call them the iPad ladies here, but there's a new generation of digital kids coming out, because that's exactly what they are. They are beginners, but they also learn very quickly, right? So we work a lot with these older people, and these are 3 85-year-olds. And what if we could help use technology to make them feel better, to make them less depressed and more connected? And we saw early that by these ladies, for instance, when they started using Facebook, it was like a third youth or something like that, or a third. I mean, they were born again, because many of these older ladies, they don't have their husband along. He passed away typically a couple of years ago. Then that's going to change in the future, which is another interesting topic. So we observed this, and then there is a big study in Exeter done at Exeter University, where they studied very frail patients, skruttiga, as we say in Swedish, and they measured the impact of using social media from a health between 60 and 95-year-olds, and they could measure positive effects it was as good as antidepressants or better without the side effects. So this is the future where these are capable women, we're looking at. And also, one of the things, coming to that in a moment, but that a lot of things will move from institutions to the home, and people. One of the things that the industry is focusing on right now is how do we keep these old elderly people healthy, and you need to do that by keeping them active. So it means that your home you could live on a boat maybe. When we talked about, we're in a project called Stockholm Digital Care, and they think about how can we support all these Stockholmers when they are in Spain so that they are very fit when they come back in the wintertime. So the home could be everywhere, and this is something I can pretty much certain that you've heard about this, Pio. This is the pretty much everything I've said so far, at least, can be found here. So this was an attempt to create like an Apollo project for Sweden when it comes to this. We need to move quickly because there, as you will see soon, a lot of things are happening everywhere. The first trend then, healthcare providers, they are actually now they're going digital, and this sort of digital service business started, as we all remember, in basically in October 18th, 1995. This was an ultra cool site with the latest technology. I was in the business back then. We're using cool technology called image maps. So you mapped region of this image. When you clicked here, you pointed to a certain URL. Ultra cool. I mean, it was Rolf, you remember this? You were like a HTML programmer back then, right? Maybe, but that's not the point. It's actually that the internet banks understood the power of internet, and when it comes to customer service, and can we actually do something that is less strenuous on us and more, but it's more value for the customer. It's a win-win, and it was back then called self-service, if you remember that. So it was kind of an odd concept, but everybody was hooked, and now the same thing is happening actually around the world, I would say. We're talking about new actors in a bit, but the traditional healthcare industry like Landsting and NHS in Sweden and the big providers are pretty much at the same state. What you can do, here in the UK you can actually book also, not just cancel appointments. Order repeat prescriptions and access some information of your medical record. So this is happening right now. As you can see, there's an interesting difference between NHS and Sweden is that they just rolled something out nationally. Just one NHS and then 55 million users, potential users could access it. We have a little bit trickier situation here with 21 county councils and 290 something municipalities. So this is interesting, but it's coming everywhere. And it's kind of state of the art right now. This is interesting. This is Memorial Sloan Kettering, a cancer hospital. You can now send and receive secure non-urgent messages with attachments. Send and receive. And does this sound like rocket science? Can you do this in Swedish healthcare, do you think? Can you send a message and get something back? Not normally. But this is typically, and this is actually, if you look at one of the most advanced medical providers, or the healthcare providers in the world, in the US, they see this as the sort of really the bread and butter digital service. This is something they use. So you can check them out. The name is Kaiser Permanente. So they have like a 10-year plan to reduce the physical visits or increase the non-physical visits from 100% 10 years ago to 25%. I had a 10-year plan to do it, because it takes 10 years. It's so complex, complicated. We're dealing with people, lives and death. So this is takes time for things to get traction internally, externally. But they've seen this. Now they managed to, by using this email, secure, so it's encrypted. All right? So it's just not Gmailing people and put it on Facebook. They managed to get down to like 40% physical visits. And at the same time, the perceived sort of customer service is actually going up all the time. But it takes persistence and some kind of, long time. So this, and also apps, of course, you can do the same thing. But the thing is now, the new actors are coming. And this is a big thing in the US, right? Doctor on demand. So it's, of course, Dr. Phil is behind this, and a lot of investors. So it's pretty much just a network of, I think, 2,500 doctors. So it means that you can, if you want to see a doctor now, I've tested it. If I want to see a doctor now, I can take a look at or discuss my knee or something. I can typically get an appointment here in 5 minutes. Sounds like science fiction, maybe, but the promising thing and the exciting thing is that now we have a Swedish equivalent. I met them yesterday. Very interesting. And I asked them, why on earth are you able to how could you come up with something so good? Because it's good. I mean, it's perfect. And he said that, the explanation, we don't have any people from healthcare here involved in the project. Of course, we consult them, but we are from the consumer, whatever you call it, consumer electronics or consumer services. So we know how to design things. So check it out and try it out also. It's fantastic.
But those are real doctors.
Real doctors. Yeah, that's real doctors. Good. Real doctors. So this is. So a lot of the providers are trying to use both these sort of primary care stuff, but also more serious stuff. And this is something also, just as an example, this is a PIOS project about COPD, which is a big thing around the globe. And here it's actually most of you probably can read Swedish, but here we have the home, and also we have some solutions here for the patient. So it's all sorts of things. But this is also an example of where we try to help them to exploit the digital channel. Interesting enough, we won't go into this, but it also creates the need for a new role here. Maybe we could talk about this forever, but you've probably seen this. But I think this is a good example of a more heavy duty, because a lot of things are around primary care, but then we come to the heavy stuff like this. So you want to say something about that, or have they heard it? Yours. Then the second trend is do-it-yourself healthcare. It's not a sort of amputation or something like that, but so somebody used to do something. You needed somebody to do something that you now can do yourself, regardless of if you're a doctor or a patient. So it all started back, as you know, with Mr. Spock. You remember him? The 70s, right? He recently died. Yeah. And he had a number of, 3, I think, versions of this tricorder, but we're obviously not just going to talk about the medical tricorder. The cool thing, this is from the 70s, and we talk about, this is an abbreviation of the primary functions: sensing, computing, and recording. They didn't think about, transmitting back then, but maybe that's included somewhere. So this is cool. I mean, and now it's here, this is where are you, Lennart? There. Yeah. He showed it today. Yeah. So it's like a puck. So this, so you can see it, and it you put it against your forehead, and you get like 7 or 8 vital signs, but it's basically a light, LED, and it reflects, and you measure. And then from that basic measurement, you derive other sort of approximate values for blood pressure, etc. So you see, it's actually it's
And
Frank.
interestingly, the level of oxygen in your blood.
Yes, precis. It's very useful. It's very useful. I've tried it when in a plane at 10,000 meters, and you think you're going to die. Another question about this is how do you make all this data useful? You know, that's a big thing in the business right now. Okay, I see these numbers, especially I see many numbers. Okay, what do you want me to do now? Or should I do? Maybe I shouldn't do anything, or should I dial 911? Or this is an interesting, very interesting challenge here, because everybody has these clocks and they produces trillions of data. But how do you make them? But I think we have some researchers around here that could help us with that. Okay, so basically, U.S. doctors are ready to roll when it comes to digital solutions. So the 74% of them would like to have something to help them to check ear infections. And everybody who has had child with ear infection knows it's a very pleasant thing to take them to the doctors, sit in the waiting room for 2 hours and drive back. So you now can totally avoid that. But either it could be the doctor. It's just a lens and software. So it's very cool. So it could be the doctor, or it could be also the parent, and the doctor will actually watch remotely. So this is actually changing the game here. Another thing is cool is this mood ring. Lennart, that's cool. The mood ring. Yeah. Because, as you know, there's something, lie detector. It uses something called galvanic skin resistance. So, and the thing with that is that the further you go out on the limbs, the more dynamic data you get. So if you have it here, it will not give the dynamic range enough to do interesting stuff. But if you put it out here, it will give very good readings. And therefore, somebody took this idea and then developed a ring. How can you live without that? And you can find out how stressed you are.
Yeah, that's my problem with that.
But the thing is, we talked about that with the MS patient there at the seminar, and she said that she would like to have something that can make her understand, because everything is happening inside your body, intrinsic, so you will never see these chemical things going around. But for instance, if you can afterwards analyze the situation, why did my brain stop operating? And you could actually try to understand, analyze the situation. And she would like to have definitely one of these rings. Right. Okay, so we shouldn't forget about the doctors. This is also a big thing now. So what's the next stethoscope then? Equivalent of a stethoscope. That was a major thing for physicians, and of course this is something that people around here has been writing about. So without any further ado, it's big data. So as you all know, this machine IBM Watson can do a lot of fantastic things, like winning Jeopardy. That's amazing, right? And also recommend your next song. But now that in the States they are using this as a sidekick, or they call it a second opinion for the doctor, But it's typically in 80% of the cases it's the other way around, because what they've seen is that when you're a doctor, most of the information that you need in order to understand what is the diagnosis and what is the good treatment is unstructured information. So it's not something that you will use, forms or something to find out. You need to. It's everywhere. It's a combination of many things. So this architecture is built to handle that. So they've tested this in typically, I think, in cancer care, but also in other areas, but mostly cancer care. So they can do now, IBM Watson can do things in minutes or seconds. That takes weeks for a very good doctor. So what they actually do what the computer does is that it takes all information from the medical record, from journalsystemet, from other sources, and then compile together a story. So this is a case description. The cool thing also is that they're using experts. So the idea is to combine, for instance, how can you combine the powers of people in computers and together in some kind of mix. And this is from the this is used in real life, but also this is from the doctor from the training of the new doctors. So what they can do, they can actually see a little bit how Watson is thinking, and also they can click on things and understand what's the evidence for this. So this is used as a tool for the doctor, not so that everything will go through, because they're pretty early in the process. They came out with they understand that a machine can never do everything here, in this case at least. Not now, maybe in the future, I don't know much, but it's exciting to have this as a digital sidekick at least. It's very powerful. Another big thing is that, of course, is the pharma companies. They have so much money. They are super rich. So what do we do now when we have all this money? And this is a quote from a big pharma executive in the States. Because they have a very fierce situation now with all these the people copying them, the generics. So the competing companies, they just when the patent is ended, they just do a copy of it, and they have to come up with something. What if we can't make money on selling pills? What can we make money on in the future? How do we create value? And that's a very interesting question, because, as you know, the business model of pharma is kind of weird, because they make money on pills. The more healthy people get, the less pills they need, right? So it's kind of negative model. So in the future, everybody believes that they will use all their knowledge, and they're sitting on enormous amounts of data, and they will use that in some way to getting paid for keeping people healthy. Or, for instance, if you're working with a population, if you can go take down the prevalence of type 2 diabetes in Kista, for instance, and if you get paid for that, okay, it used to be 10%, now it's 5%, okay, so it's like a really win-win situation. And this is one of the guys from their innovation team. And they need to come up with new solutions for doing what they call outcome measurements. And the interesting problem we have now is that a lot of the patients have multiple chronic diseases, so they take many pills. All the clinical trials, basically, as far as I understand it, require you to not take any other pills. So we don't really know much about how these interact in the real. So in the future, maybe you could do also measure outcomes, not just on a single drug, but a real person, a typical 8-year plus. How does this work? And then they need some new technology in order to do that. One of the things we're doing here locally is that, if you haven't seen this, it's Karolinska möter Kista, and the Kista in this case is, of course, Swedish ICT. Isn't that right? So there's a brown bag lunch, where we have some famous scientists. Isn't that right?
Very famous.
And the cool thing is that we have a very interesting situation where the host is Magnus, and then we have Magnus from SICS, and then we have Magnus from Karolinska. So we just have people, Magnus's, keep it simple. So this is cool, and because they are really serious, they are looking beyond the pill, and it's great that we could be part of that potentially. Okay. All right. I can ensure this is the last trend then, because we're talking about 5 initially, so we're going to keep it that way. Data-driven medicine is a very hot topic, and a company that usually is not that stupid and have understood that, and that's of course Apple. So they, as you remember, was it a year ago they introduced HealthKit, right? The idea with HealthKit is to, if you have all these apps producing a lot of data, and I'm a developer for instance for a new app for Mayo Clinic. So then on my iPhone I can just access like a common database of all the data in HealthKit, and there's an API for that. And that's HealthKit is really an SDK, a software development kit. So the big names, Mayo Clinic, and for instance, they've done this already with the integration with Epic, which is the big electronic medical record supplier. So that was the one of the things. So the idea is this should be very easy to share data from a patient to a doctor, for instance. So effortless, right? And then this was very exciting. It was a really, for me, a big moment, I would say. It was when they came out with Research Kit. Have you seen that, or have you heard about it? Yeah. And unfortunately, I can show you a picture now, a movie, but there's no sound, so we skip that. But what this is about is actually rebuilding the landscape for clinical trials. So clinical trials, as a person in the film is talking about, she said that we send out like 60,000 forms, and we got like 200 replies, and that's a university. So they spend 60,000, times 50 cents or whatever, just on stamps, and got 300. With this new technology, you can actually not only capture things once, but you can also do this on a regular basis, or every day actually. So the cool thing is that they are using all the sensors in the phone to capture data when you move around, and if you sleep or not, or you could use it for gait analysis. If you walk, and you can see how wobbly you are, and it also can ask you a question like this. The app, name 2 things that made you feel better today. That have various types of data, which is impossible to capture, I would say, with using a traditional, like a form, paper form, or a form on a web page. So this is something that we Merck, they are interested in looking at how could we use tools like this to handle this situation with patients that take a lot of medicine, and capture what the effects of that medicine is in real time. And that could also be a very, very big chance for Sweden to get back there, because we're still a very, very good country for clinical trials, but it's becoming too expensive, and everybody else is getting personnummer, So we don't have that advantage anymore. So they think that if we do something around data capture and big data, and they don't know exactly. So we're going to talk to Apple and see what we can do, and maybe we need to go for an open source or more cross phone platform. So I think this is a fantastic opportunity for an organization like us, and these are some of the things that I just went back and said, what do you need in order to get this rolling? Much more, of course. This is just some of the things. So certainly we have the right skill set, I would say, to be very useful in this industry. And also, it should not just be useful. We're trying to create some growth, and this is no matter which graph you're looking at or diagram. The growth. This is for mobile health, mHealth. Show me any other market with this kind of growth figures right now. We have deflation here in Sweden, for instance, and this is fantastic. If you look at the numbers for home health care, like the COPD. It's also going up there. So, I showed you this picture of this man. He's sitting on on the foredeck of his home or his boat, summer home maybe, and he could actually he had just used his iPad here to visit his doctor. So it's visiting doctor from his boat. Now he's involved in educating other COPD patients about how to cope with COPD, and he's getting paid for it. So this is so we hopefully we are contributing to a brighter future. That's the what I think. All right. Any questions? Objections? Have I missed anything?
I can ask the same question that I asked Karolinska earlier today.
Yeah.
And what about integrity and the security of your personal data? And I mean, all these small companies that are coming out online and they're collecting all your intimate data, say, and then they can possibly sell that on to possibly future employer or something. Yeah, absolutely. It's as we know with all tools or technology, there's an upside and downside. There are some threats and opportunities, etc. And I think we need to take that very, very seriously, because just imagine a situation where we have all this data and it sort of gets in the wrong hands. It's not a good thing. And we know that, for instance, in the US, some insurers, they use this data already. If you supply us with the data how you drive, you put a GPS puck in your car and you will get a lower premium, right? But it always should be with consent. So if you share something, you should be in control. And also I think it's very, very important that's why I had security and privacy as one of the main things here. Because let's say I'm a frail person, I'm chronically sick, and I must be 100% sure that I can trust the system. And that's why I put open architectures, these systems and standardization. So I think that's key. So as a citizen, you should be able to trust the system. I mean, otherwise it's because when I do my tax returns, I know that I think I know that nobody else will be able to. They can look at them, but maybe fiddle with the bank account number or something like that. So I think this is because we talk about investments from society and from the providers in technology, but there's a equal investment or even bigger investment many times from the individual, from the citizen. So I think this is very. But in the States right now, they have this one of the trends that they are talking about. What's the balance between privacy and convenience? So that's sometimes that's not contradictional, but any other? Yeah.
So what about the incentive structures with
Yeah.
doctors? I mean, if I understand correctly, today Swedish doctors don't get paid for answering emails with questions, but they do get paid for answering the same question IRL.
Yes, and that's going to change.
Yeah, but
that's one of the Daniel Forslunds. He's a fantastic guy doing a lot of great stuff now, and he's from Vinnova, and now he's the innovation. Heading up the innovation activities in Stockholm's läns landsting. And I asked him about that, and he said that's one of my main priorities. I know in the States, for instance, it used to be that you couldn't get paid for submitting patient-generated data if it wasn't in the room, but they've changed it, and that has been a driving factor for subscribing apps, for instance. So I think that's a very, very important, interesting topic and question.
The medical society, the Läkarförbundet, is very hesitant.
Yeah, there might be, but I think I see so many positive signs. Even though I'm slightly an optimistic person, but it has been a sort of a change of attitude. But of course, as you know, doctors, they're trained to be skeptical. Can I trust what I see? That's in the job description. So we must have this situation with the smiling patient, smiling doctor work together, not against each other. And I don't like that situation where we play them against each other, because everybody that I meet are looking at the same situation. Okay, how can we improve people's lives? That's why I've chosen this job in the first place. But then we have the incentive system, we have also business models, we have legislation, but a lot of people are working in the right direction, I would say. Okay? Yeah?
So I wonder whether... Thank you. I wonder whether you think that currently the technology already reached the level where these e-health services could, explode, or we still need something fundamental to happen in order to reach it. For example, are the cameras in iPhones are good enough to see the, for doctor to detect the ear inflammation, or are the sensors good enough, or do we have enough of these type of sensors, or even other things like is privacy preservation technologies are there. So what would you say? What are the biggest obstacles for things to explode?
That's a good one. A big question. Many obstacles. If you read the report, you can see many of them. But I would say that the single most important thing, I think, is the knowledge level among the decision makers. That's one very important thing to work with, to make them, we're talking about digital natives. My kids, for instance, they're 25 and down to 22, and they are digital natives. They've been using Macs like me since they were born. For them, digital is nothing odd. It's nothing separate. It's like okay. So I think that's very, very important. But the thing is that we see a great everybody. They have, as I see it, a real sincere. They have a desire to learn more. So there's not that we don't meet that many people that are sort of negative, but they need to know a little bit more to make some qualified decisions. But then we have the legislation, we have the business models, and I see a challenge with how do we make all these systems work together. Systems integration, the national, service architectures. So because we have a country with many regions and many municipalities. So how do we make this? It's like a spaghetti situation. So that's from a system architectural point of view, that's probably one of the biggest challenges. And then we have standardization. We must decide upon all these devices on a device level. What does a blood pressure cuff? What kind of language do that speak in order for it to be transmitted somewhere? And then you have to take it in the receiving end. How should we handle the information there? And I think that's for me, and also for the people working in e-health department here, is that we believe in that Sweden must actually adopt international standards for two reasons. Because one reason is that we could benefit from the international development, and we could also use our fantastic companies here to develop things abroad. Yeah. Okay, all right. Thank you for watching, and hope you will be back next time. Thank you.